Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined by Lanette Siragusa, the Chief Nursing Officer with Shared Health and Co-Incident Commander for the health response to COVID-19 in Manitoba. Today we're providing information about Manitoba's COVID-19 response to date and information about some of the models that we've developed to determine the possible effects of COVID-19 here. And so, do we have the slideshow up here? Good. Okay, so we can see the case numbers here. So as, this morning we've conducted 24,304 lab tests. There's been 273 positive cases, with 213 listed as recovered, with 54 active cases. At this time, there are 5 Manitobans in hospital with no one currently in intensive care. 6 Manitobans have died due to COVID-19, and again, extend our condolences to their family and friends. So this is a epidemiologic curve of COVID-19 to date in Manitoba. And as you can see, there was a significant increase in cases at the end of March and early April. However, recently, in the last, especially in the last 2 weeks, we've been seeing a much slower increase in cases. We've averaged under 2 per day in the last 2 weeks. This is that same epi curve, but now showing us the timeline and infectious sources for Manitoba cases. And you can see early on, as expected, the majority of cases were due to international travel. But as travel restrictions were put in, and as more cases were introduced into Manitoba, you can see that we saw some more community-based transmission and transmission due to contact with known cases. As of April 26th, 44% of our cases were linked to international travel, 5% were linked to domestic travel, 35% of our cases were linked to as a close contact of a known case, and community transmission, or those unlinked cases, represent about 14% of cases currently. So this graph depicts the current status of cases in Manitoba. We can see that since we started tracking the number of those that are recovered, we can this way guide our current case load, our current active cases, and you can see that we've seen the number of recoveries increase as the rate of growth has decreased. So you can see that our active caseload has continually decreased as of late. There's a number of health interventions that were taken as soon as possible to ensure our healthcare system had the capacity to address the epidemic. As soon as it became clear that person-to-person transmission was taking place, we made the novel coronavirus a reportable illness in Manitoba. We took steps along the way to strengthen our responses. These include suspending classes in Manitoba K-12. And closing licensed daycare centers. We declared a provincial state of emergency on March 20th. We had issued advice to reduce international and domestic travel. And later came public health orders to limit group size gatherings, closing restaurants, bars, and suspending non-critical businesses operation, and requiring physical distancing at critical businesses. We further expanded our testing criteria on April 17th, extended public health orders to May 1st, and the provincial state of emergency was extended to May 18th.
In response to this emerging public health crisis, Manitoba's health system also acted swiftly in response to the threat of the virus. So HealthLinks quickly shifted to a central role in screening patients before they were sent for testing. Capacity, staff, and phone lines were added in response to the significant demand, and wait times decreased from hours to minutes over a fairly short time period. An online screening tool further supported this work that was provided in both official languages. Testing locations were opened up in all regions of the province. Visitor access was restricted, staff screening into facilities was introduced, and non-essential diagnostic services, non-urgent surgeries, and procedures were postponed. At the same time, alternative isolation accommodations have been established both in hotels and for the shelter population, with a model that is quickly able to be spanned throughout the province as the demand requires.
If we look at the comparative speed of public health response, Manitoba reported its first case of COVID-19 on March 20th. It was on that day that we began recommending physical distancing strategies. Because Manitobans had taken this seriously right from the beginning, practiced the social distancing strategies that were in place, followed public health advice, we've seen this flattening of the curve because we were able to act early. So again, thankful to Manitobans for their hard work, their sacrifices to keep our numbers relatively low, and it's put us in the position now to be able to look to start slowly loosening some of these restrictions. We've mentioned many times flattening of the curve, and this is a graph that really demonstrates that. You can see that with little or no public health interventions, we would get a very high peak of cases very rapidly, and that would overwhelm our health system capacity. And so that would lead to excessive morbidity and mortality. As we try to flatten the curve, all of these public health interventions that we mentioned are to decrease that peak, to spread that peak out over time, to maintain our health capacity, to be able to still serve Manitobans, to protect Manitobans, especially those that are vulnerable. In doing that, as we flatten the curve, we do extend it. You can see that the length of the pandemic is extended, but having these fewer cases but spread out over a long period of time, we're able to address the health needs and decrease the impact of the virus on Manitobans. We looked at some projected numbers of cases with minimal health, public health measures. And again, this is important to note that our models here, this projection is based on minimal public health interventions. We didn't create one that had no public health interventions because it would be just not realistic to do that. We'd always have some sort of public health intervention. So this is minimal public health intervention. That shaded area there represents the range of possible cases. And then the line represents what we would expect in cases. And so certainly the measures that we implemented were much stronger than what we would say as minimal public health interventions. All those interventions that we talked about with the social distancing, the orders, the travel restrictions is what put us in the position we're at today. So under the routine measures, our modeling would suggest that Manitoba would have had 933 cases by April 25th. If that trend had continued, there would have been more than 2,000 cases by mid-May. So currently, well, at April 25th, we had 267 cases due to Manitobans' adherence to our recommendations. We compare Manitoba to other countries, and you can see that our trajectory took a much different turn than many other countries. We were able to avoid the long, sharp increase in cases, and you can see that our graph as of late has been relatively flat, and so we were able to keep our demands within our healthcare system capacity. We can look to other provinces as well, and you can see that comparison stays true in many of the other provinces. We've started on a very similar trajectory, but we've been able to keep a relatively flat curve over the last number of weeks. So Manitoba testing, certainly this was a critical component of our strategy, and it's going to be a critical component of our strategy going forward. And we've had quite a bit of success in implementing testing here in Manitoba.
So this depicts how one accesses their testing through the locations that have been operationalized and staffed throughout the province. So each regional health authority supported the creation of these screening locations, health links, and our central contact tracing center. So these locations are staffed by more than 300 volunteers, including residents and former nurses, as well as our own employees. There are many locations that have now transferred over to a drive-through location. And 2 sites in Winnipeg have been established that serve not just testing, but assessment for patients who are COVID positive or have similar symptoms, respiratory symptoms, to have their healthcare concerns addressed.
So in addition to the great work at those testing sites, we were able to increase our testing capacity over time due to the ingenuity and expertise of our folks at CADM Provincial Lab. And so they've really stepped up for Manitobans, and I've thanked them a number of times at our conferences, but can't thank them enough for their hard work and dedication to the health of Manitobans. So CADM Provincial Lab is able to perform right now roughly 1,000 tests per day. And as you've heard, with a partnership with Dynacare, we're going to ramp up an additional 2,000 tests per day before the end of summer. And so all of this capacity increase has allowed us to increase our testing criteria now that all symptomatic Manitobans with respiratory symptoms are able to get tested, and it's going to be a big part of our approach moving forward. Here's a test here comparing tests per 1 million of residents compared to other jurisdictions in Canada. And you can see that Manitoba is about mid-road in that metric. You can see that there's been some jurisdictions with less testing than us as well, but we're about mid-road. One of the most important metrics that we've been following is the test positivity rates. And you can see that Manitoba's rate overall has been about 1.15%. So very low test positivity rate, which really indicates that our testing numbers are adequate. We're not seeing that increase over time. And this is going to be an important metric that we're going to be measuring going forward as we move to loosen some of our public health restrictions. Here's daily test counts and detections, and you can see that early on in the outbreak, where percent of positive tests were higher. But as the public health interventions were in, as Manitobans worked hard to limit the spread of this virus, we could see that drop in our positivity rates, and which is another metric to show that our Manitobans' work at this has been effective. Manitoba now has quite a broad testing criteria. Now any symptomatic Manitoban is eligible for testing. So we want to ensure that we continue to detect cases early, to isolate cases, and do aggressive contact management. It's going to be a large part of our strategy going forward. So we've been able to compile some modeling slides that we want to share with everyone. And this is the Health Sector Incident Command Team was established, a capacity planning group to help plan our response to the COVID-19 pandemic. And this was supported by a modeling group that can help us understand how the virus may affect the Manitoba population based on available information and other disease models. Through this briefing today, we're going to making available our assessment of what we might expect in terms of cases and estimates on demand of the healthcare system, and then our plans to ensure that the necessary healthcare resources are in place. So for our modeling, we use an agent-based model for the spread of COVID-19. And so it was using information available in the scientific literature and input from experts in Manitoba. We've had information regarding cases in Manitoba that was used to calibrate the model. So it's really a made in Manitoba model, specific for our province, our case numbers, our population. So modeling, again, it's an abstraction. It can't project all possible outcomes, not a crystal ball, but it can help in certain aspects of planning. But it's just one tool that we utilize. We know that outbreaks evolve over time. Things like the behaviors of the public can change outcomes. And so it doesn't tell us what will happen, just tells us possibilities of what will happen. You'll see there's a number of ranges on there. So we intend to revisit and reformulate these models over time as we get more data, and we can be happy to present those. And we've been working in collaboration with Public Health Agency of Canada's modeling effort, exchanging knowledge and comparing results. So if we look at some projected number of cases, the shaded area here represents the range of possible cases, and again that blue line represents the number of cases we would expect, and the black line is our current numbers. The first case was again confirmed on March 12th. By April 25, there were 267 confirmed and probable cases in Manitoba. Our model predicted 408 cases at that time. So the model slightly over-predicted the number of cases, but it sure was still within that range of possibilities that we had. The model projects that under the current public health measures, there could be around 500 cases by May 8th. And if the current public health measures remain in place for a year, Manitoba could expect approximately 6,250 cases.
When we look at system capacity of the healthcare system, we acknowledge that we are working in an extraordinary time, and COVID-19 has significantly changed our lives both at home and at work. So from a healthcare perspective, when we look at our response, we want to be mindful of what is our usual capacity, but also what is our ability to expand it as the need demands and patient volumes increase. And we are aiming to be nimble and flexible and responsive to that need. And that is typically how we work in other situations like with H1N1 or the OR flood at St. Boniface Hospital in the past. But we also have to recognize that it is a significant demand that COVID-19 could place on our system capacity. So the limiting of visitors, postponing surgical and diagnostic activity, implementing the enhanced screening of staff have all been changes that are motivated by the need to keep our system capacity intact and functioning at a high level. So it is important ongoing that we protect our patients and our staff from the spread.
Next, we can look at hospitalizations, cumulative hospitalizations. Again, the shaded area represents that range of possible cases. The blue line is the number of cases that we expected that our model predicted, and the black line is our current data. So again, the model slightly over-projects this data. The model projected 46 hospitalizations by April 25th, and at that time we had 29 hospitalizations. So again, within the range of the prediction. By May 8th, the model is projecting approximately 14 additional hospitalizations.
So from a system perspective, we have throughout Manitoba 2,432 acute hospital beds. And our current occupancy right now is significantly lower than we usually see. And part of that is because of the surgical cases that have been delayed and the procedures that have been on hold for the last few weeks. But it does also reflect a lower occupancy in the medical units as well. So as we talk about the need to increase surgeries and increase those procedures back into the system, it is a balance of making sure that we have capacity, we can maintain staff safety as well as for patients. So we expect to do this carefully and thoughtfully, but appreciating that those peaks and valleys will affect our acute care beds. So at Health Sciences Centre, St. Boniface, and the Grace Hospital, there are dedicated COVID units that have been established and staffed. Outside of Winnipeg, planning has ensured that there are specific locations for COVID positive patients when they are identified. So our planning has also identified the ability to add an additional 300 medicine beds into the system if required. And this includes staffing and equipment the equipment may be that we already own, and it also includes what we have procured since starting this COVID planning early on in February, really.
So here we're looking at projected cumulative ICU admissions. And so again, that shaded area is the range of possible cases. That blue line is the number of cases that were predicted. And the black line is our current data. So we can see that the model slightly underprojects the number of ICU admissions. And this is largely due to the small numbers that we're working with. By April 25th, there have been 13 stays in the ICU. And the model had predicted 6 stays. And so this is within the range, dealing with low numbers, so projections become difficult. But those are the rates of ICU admissions that we're experiencing here are quite similar to other jurisdictions in Canada.
Across Manitoba, we have 86 critical care beds. And our volumes currently, just like the inpatient beds, are lower than they would normally be. So we have additional capacity. At the time of this slide deck being made on April 22nd, there were 29 funded critical care beds available. However, this number does change day by day and hour by hour, and is impacted by changes within the system, including surgical activity. It's also important to note that these 86 critical care beds do not include these special care units that are throughout the province, step-down units, pediatric or neonatal intensive care units. So it's just adult critical care. During flu season and in preparation for COVID-19, much of our planning looks at our ability to increase the number of beds. And through this planning, we have been able to identify if we need to, we can flex up to an additional 100 critical care beds if required on top of the 86 that we currently have. We have 296 ventilators in the province now, plus 1 for every surgical suite that is, again, throughout the province. That equates to 136 additional ventilators as well. So as we plan for the reopening of the province, efforts to prevent, quickly identify, and contain outbreaks of the virus will be vital to our ability to resume a new normal while ensuring we take every step to protect our most vulnerable populations. We are still very early in the fight against COVID-19, and we are benefiting from our opportunity to learn from other jurisdictions in terms of what has worked and what has not. So our ongoing plan as a healthcare system is to prevent, to test, to trace, isolate, treat if necessary, and repeat. So we will prevent the spread of the virus by continuing with various restrictions, including the visitor restrictions. Staff will continue to be screened daily for signs of illness upon arriving to work. Public information on testing will continue to be supported through HealthLinks and our online screening tool. We will continue to work on ways to make testing more accessible, including looking at ways for additional drive-through testing, We're looking at mobile testing, where people would go to your home, and ways to improve upon testing for our shelter and homeless populations. We're also looking at ways where we can make the testing results more accessible for patients, and potentially looking at an online tool, which I will tell you more about next week. And we know that rapid and robust contact tracing is needed to ensure that all possible exposures are identified. We need them to be isolated, and we may need them to be tested if appropriate. Our occupational staff health has been bolstered to support contact tracing for healthcare workers who may have been exposed to the virus. And the Central Contact Tracing Center has also been established to support the work of public health officials. Staffing numbers have been increased in this contact tracing center, and we will continue to monitor activity to ensure that they are able to keep up with demand. The isolation protocols for people who are suspected of having or tested positive for COVID-19 are in place to limit exposure and mitigate the spread of the virus. We have set up a program for alternative isolation accommodations that can quickly be expanded throughout the province, as well as we've identified through a provincial RFP and are working with our partners to ensure that we have clear protocols throughout. And as I've said a few times, we continue to have the capacity to treat patients for COVID-19. We also have the ability to significantly expand the health system's capacity if needed, with 100 more critical care beds, 300 more medicine beds, as well as alternative hospital sites as a contingency if we need that. So we'll keep repeating this process as needed, because rapidly identifying and responding to outbreaks is essential to our long-term fight against the spread of COVID-19.
Good, yeah, and so I mean, you can see that from these case numbers and our projections that we've been now able to look to ease some of the public health restrictions. And so it's important to note that this is not a return to normal. We're still dealing with this virus. This virus is still in this province and could still spread if we let our guards up. So these easing of these restrictions still come with cautions. Physical distancing, hand washing is still going to be an essential component to how we deal with this virus. Those who are at increased risk of severe outcomes of this virus, those over age 65, those with underlying medical conditions, those with immune compromise, need to continue to follow our previous advice, to stay home for the most part, to go out for essential reasons, to practice strict physical distancing. But as Manitobans have all stepped up and kept our numbers down, now we can loosen some of these restrictions. Again, it's not a return to normal. It's a loosening of the restrictions. We're going to do very gradually, and very close watch of our numbers, very close watch of things such as case numbers, such as our lab test positivity rates. And if our numbers continue to look good, then we will continue to loosen these restrictions as appropriate. So again, thank you to Manitobans for stepping up. You've put us in a position now where we can start to gradually reduce these restrictions, but all Manitobans know how important this is. That's proven in our numbers. And so Manitobans are going to continue to know how important it is to follow these strict guidelines going forward, and we'll keep you up to date with numbers as they come in. So thanks again.
Thank you.
Thank you. A reminder to our reporters online, you will have one preliminary question and one follow-up question. Up first this afternoon from CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Dr. Roussin, in the reopening plan, it states that travel restrictions may be relaxed in sort of the second phase and the further phases. What would that depend on? I imagine there would be some circumstances out of our control, for example, the situation in other provinces. But what would that entail? Would that be something like maybe no 14-day self-isolation after traveling from another province? Could travel restrictions be relaxed sort of in waves, as obviously the overall plan is coming?
Yeah, so nothing, nothing's off the table right now, and it's going to really depend on what we see in our jurisdiction and in other jurisdictions. But we definitely wanted to let Manitobans know that this is going to be a phased approach. That they've been living with a number of restrictions for many weeks now. But because of the numbers, we're able to loosen some of those. And if the numbers continue to cooperate, then we are going to continue to loosen them as appropriate. So those type of restrictions, could be altered, but it's going to really depend on what we see. We're going to have a close observation on this. And we're going to ensure that the only restrictions that we have in place are those that are essential to protecting the health of Manitobans.
Okay, and then as a follow-up, as far as hair salons opening up as soon as Monday, it sounds like that could look like homemade masks for the stylist and the person in the chair with limited capacity in the salon. What exactly is this going to look like in terms of PPE? And while I know many people are really looking forward to getting their hair done, how safe is it to go and get your hair cut or get your hair colored at this point?
Yeah, so this is we have the multi-step approaches to this to ensure that people can stay safe, right? So and it's always back to those basics. If you're ill, stay home. So if you're ill, you shouldn't be working, and if you're ill, you shouldn't be going to get your hair cut. So these are these fundamental things. So we're going to need to continue to rely on Manitobans to adhere to that. Frequent hand washing, social distancing within the salon between other patrons, and then hand hygiene within the shop, and certainly physical distancing can't be maintained when the service is provided, but certainly there's a number of precautions that can be put there. So non-medical masks certainly are an option, and people can certainly use that, but again, knowing that it doesn't protect you, it protects the people around you, and it's not a substitute for those very basic approaches. And going forward, one of those biggest ones is we're going to really rely on Manitobans to stay home when you're ill, even mild symptoms. Stay home, really ideally 14 days, and we'll really continue to decrease the impact of this virus.
From the Winnipeg Sun, Scott.
Hi, Scott Billis from Winnipeg Sun here. There wasn't any modeling done on severe outcomes such as death, at least none released today. Is that coming, or why wasn't that released?
When we look at something like deaths, we're looking at relatively low numbers. So you could see with the ICU admissions, even there, we're looking at quite low numbers. So modeling becomes quite difficult. You're going to get a very large range, which makes it really not all that useful. So we modeled the cases and the hospitalization rates. The ICU, again, with those relatively low rates, gave us a large range, and we would have seen the same with deaths. So it's not all that useful of a projection.
And my follow-up is, given all the modeling that was released today, is there any in place that would, given the reopening next week, that would suggest what case numbers could rise to, given with the reopening strategy that's coming?
Those are the type of models that we're running currently. We're going to try to adjust the agent-based the formula on there to try to factor in some of the easings of the restrictions, and so those are things that we're going to adjust and revisit and share again as time goes on.
From CBC Radio Canada, Laisa.
Laisa Pamos, CBC Radio Canada. Dr. Roussin, I just want to have this clear. In the plans, one of reopening announcing this morning by the Premier, do we see like shopping malls in the phase one of reopening? Right.
So retail is going to be open. And again, make it clear that these are a relaxation of our public health restrictions, certainly not a directive. So any individual place of business is going to decide on their own whether it's they can meet our guidelines and whether it's safe to operate. And so with that, if malls open, they're going to need to comply with the strict physical distancing measures. So there's strict area measures, there's 50% capacity measures. So those are what's going to have to be followed.
For my follow-up, let's say are beaches considered as outdoor recreation? If yes, do we have any plans to make sure that people will be respecting social distancing when they will go to the beach?
Yeah, so we don't have beaches included as of yet. We think it'll be a little bit of time before we need to address that, but it would be like anything else. We have the ability to enforce things, but we think Manitobans got the message. Our numbers are really showing that Manitobans have listened to advice. They're listening to this. They know how important this is. And so for the most part, Manitobans are aware of that, those physical distancing requirements, minimize contact in larger group settings. And if necessary, then we do have the ability to enforce those.
From CBC Manitoba, Bart.
Dr. Roussin, Bart Lakivis here. Your presentation says Manitobans can expect 6,250 cases if current measures are in place for a year. I think you owe it to Manitobans to give us a number of how many cases we can expect for a year and state when that year ends with the reopening that starts on Monday.
Yeah, so these numbers here, when you model that far in the future, they're not all that valuable numbers. So we can look at that, but again, we're going to be changing our public health measures based on what we see. So it's hard to predict what things would look like in a year. We could be looking at a pharmaceutical intervention by that time as well. So it's really tough, Bartley, to give a year-out prediction. So we had this model just because we had it in place. But it's really tough to know when and how we'd be lifting or restricting further public health orders. So it's a real tough question, Bartley, to give you a good answer for.
Okay. Well, you've said previously that this is going to be a careful plan. This is a very broad plan announced by the Premier this morning. How many more cases and how many deaths are going to be enough for you to put restrictions back in place over the next few weeks?
Yeah, well, we have a number of metrics, and a lot of them revolve around what I've mentioned before is the, say, visits to the ER, the positive test rate. Is an important early indicator that we use, and then certainly various hospitalizations and ICUs. So this is going to be careful. It's going to be cautious, and we have the ability to roll this back as soon as we get a sense that things are turning back. But with the amount of it's a broad reopening. There's a lot of things that are able to reopen, but within that reopening, it's very restrictive. There's a lot of restrictions on businesses, and businesses know how important this is. I don't think there's any business that wants to be responsible for spreading the virus or to themselves or to employees. So I think Manitobans know how important this is. They're going to take the restrictions seriously, but we do have the ability to roll them back if we need to.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, I take it from your previous answers that the modeling numbers you've given us are sort of out of date as of Monday, given that the measures are being loosened a little bit. When you talk about 6,200 plus cases, can you tell us what you're looking at in terms of the number of cases at any one time and whether that exceeds the capacity of the healthcare system?
Yeah, and again, the running a model for a year out is you're not going to get a very accurate projection. So certainly for things like, hospital capacity, that hospital capacity could change within that year. And so we don't have that for a year out. So we just calculated our current number just to give that one long term, just a sense of what it could look like. But models going out a year, they're inherently unreliable. And so no one could really give you an accurate answer to that question.
Okay, I'll try this another way and rephrase it. If you're talking about 6,250 cases under the measures that are in place up until next Monday, what does that mean in terms of the drain on the healthcare system? I mean, a layperson will look at these numbers and say, well, we've got, a few hundred now, and all of a sudden we're looking at 6,000 plus cases. Does that not overwhelm the healthcare system?
Well, I mean, it will depend on the on the speed at which those cases come, and so, like I say, we don't have a accurate model on that, but just those number of cases over a year, with given our current hospitalization rates and the current trajectory, then it's likely no. If we stayed at our current public health measures, we're looking at those cases coming on at the same rate, but over a year's time. So those type of figures would not be looking to overwhelm our capacity.
From CTV Winnipeg, Michelle.
Michelle Gerwin from CTV Winnipeg. Dr. Roussin, I'm wondering if you could give us a specific test positive rate that you would need to see to start bringing back the tighter restrictions.
Yeah, well, there's a number of different measures, and so and it deals with things like the positive test rate. So if we start, certainly under 1.5%, we feel is a very low positive test rate. And in fact, over the last 5 days, ours has been about 0.2%. So if that rate starts climbing, certainly up into the 3, 4, 5%, then that's going to certainly be raising some flags for us. We're going to look at hospital beds and hospital capacity as well as ICU. And so we have a number of indicators that we're going to follow very carefully, and we're not going to lift any further measures until we're confident that this phase has not adversely affected our response. And if we are at all concerned, we have the ability to roll back all or a portion of these loosenings.
Great, thank you. I'm also wondering, you talk a lot about protecting the vulnerable, so the people with immunocompromisations or seniors. Why not put out restrictions or kind of do a phase roll-up by population to tell those people to stay home?
Yeah, well, certainly that's part of our plan that we're advising. So, we've, with this virus, unfortunately, the case fatality rate is about 2 to 3%. But we know that the majority of that 2 to 3% are those that fall in those high risk categories. So those over age 65, those with underlying medical conditions, those with immune compromise. So our advice to them in this phase doesn't really change. You need to still take that extra caution. Stay home as much as you can. Go out for necessities. Practice social distancing at all times, because we really want to protect those that are at most risk to have those severe outcomes.
From City News, Stephanie.
Dr. Roussin speaking with City News. Just wondering if I can get your thoughts and your recommendations on how Manitobans should go about small private gatherings from now on. Is it still for everyone, stay at home as much as possible and only go out for essentials, or how should Manitobans proceed?
Yeah, so I think, right now, we have to be clear that this is not a return to normal. That Manitobans have really stepped up and flattened our curve, and so this is really a good time to start loosening these restrictions, but we have to take it slow. We can't do too much too quickly, or it's going to be difficult to reverse any of those effects. And our actions today really are going to have effect a week or 2 weeks from now. So there's that delay. So certainly the group sizes of 10 are in effect, and those are remaining in effect right now. And then again, back to those basics. If you're getting together with other people, no one should be ill. No one should have been advised to self-isolate. Frequent hand washing, physical distancing is the best. If you do get together, then outside is even better. We know the risk of transmission is likely less in outdoor places, but. I'd still advise Manitobans that at this point we're loosening some of the restrictions, but we still need to be cautious. We're still dealing with this virus, so let's take this cautiously right now, and we'll be able to loosen things further and further if we can get those numbers to cooperate.
Thanks. And if measures are changing in Manitoba Monday, why not release projections under the new measures and what the new measures might mean for our numbers instead of under the old measures, which will be ending by Monday, and the projections only seem to go until May 23rd, if I'm not mistaken. Why not release any projections beyond that?
Yeah, so as far as the time frame, the issue with that is, projections a year from now, projections 3 months from now are rarely accurate. So we wanted to release projections that we felt were fairly stable, that we could give a meaningful number. But the longer you model ahead, the less meaningful they become. So we provided these numbers here for you. As far as modeling going forward, we are still looking at making our models predict different levels of public health interventions. Certainly it's not an exact science to know the exact effects to model as we lift some of these restrictions, because it's a lifting, although we still have some heavy restrictions on people. So we're going to try to get some numbers on that, but it's again, these projections are just one tool that we use. They're not going to be a crystal ball. They're not going to tell us what will happen. They tell us a range of possibilities, and often they need to be revisited and redone.
From the Winnipeg Free Press, Carol.
Hi there, it's Carol Sandys at the Free Press. I'm just wondering, based on your original projections and modeling from back in February or March, the information that was never really made public, are you surprised that Manitoba is in a position right now to begin reopening?
Well, I don't know if I would say surprised. I think that given our fortune with timing, we were able to implement a number of interventions early on, and Manitobans stepped up. Manitobans stepped up. The healthcare system stepped up, and so I wouldn't say surprised. I think that it's we've put ourselves in a good position to start gradually rolling back some of these restrictions, and I think this is an appropriate time for that.
And projections are usually used for planning and for looking forward. And I'm just wondering, what was the intention of releasing these projections now? We've been asking for projections for weeks, and you weren't able to provide them. But what's the intention of releasing these projections now? They're kind of looking backwards.
Well, these are looking forward. These projections. That's what the projections do. And but long-term projections are going to have a huge range and not all that useful. So we put together these with the current public health interventions. We are loosening our strategy, our measures a little bit, and we'll see if we can adjust some of those models to take that into account. But these were the numbers that we were running. We were able to run one with minimal public health intervention, and then with the interventions that we were using, and then compare that to what we saw now. And you can see that it was certainly within the range, but it's not an exact science. And so we're going to keep revisiting these, and we're going to have to revisit these multiple times.
From Global, Brittany.
Good afternoon, Dr. Roussin. A lot of people here, and you kind of touched base on this, but I know that there are grandmas and grandpas that are out there, or aunts and uncles that haven't been able to see their nieces and nephews. can they now go? Is it safe for them to, go to grandma's house, give her a hug, maybe spend a couple hours over there? If people are still washing their hands and all of this, a lot of people asking, can I go and do that? Because they've been waiting a long time.
Yeah, so it's been a challenging time for Manitobans, right? And it's been many weeks, and so we know that, and certainly these numbers are where we wanted to be. This allows us now to loosen some of our restrictions, but again, it's not a return to normal. And we really need to, at this point, as we go forward, as we're starting to loosen things, we need to protect those most at risk. And so, it's still a time of caution. And so we're able to loosen things. Certainly the group size fits. Certainly those things that anyone who's been even mildly ill or anyone who's advised to self-isolate, you should be at home. If you do go out, for the most part, physical distancing is still important. Lots of hand washing, as you mentioned, is still important. But we need to really be careful around those that are most susceptible to severe outcomes. So, we're able to loosen things. Doesn't mean we're safe. It just means that this is the time that we can start loosening some of the public health restrictions. So, I want Manitobans to continue to be wary of this virus. This virus is still there, but Manitobans have done such a fantastic job at flattening this curve that now is the time to loosen some of the restrictions, but we do need to be cautious still. We need to take it slow.
And then just looking at the different phases, I know we've already had some businesses reach out to us. Can you speak about the differences of why maybe a hair salon is in phase 1, but a nail salon is in phase 2? Or when you look at gyms or fitness facilities, can some of those smaller boutique facilities open up if they can ensure distancing between their clientele?
So the big aspect of this is the phased approach, right? We have to be able to do this gradually to see how our numbers respond, and then we have to be able to roll it back if necessary. So certainly not all classes of businesses are included here, and that's because we don't want to open everything up at once. We have to do it in a phased approach. So if we look at hair salons and barbers, working on on a client on the hair is different than say in a nail salon or in other aspects where you might have prolonged face-to-face contact. So that's some of the thinking there, but also the thinking is we have to find a phased approach. We have to find a way to not just open up everything at the same time, or we're going to have a real difficult time rolling things back if necessary. So this is the phased approach we looked at. We had a lot of stakeholders in it, and we're going to do it slowly and cautiously.
From the Brandon Sun, Bud.
Hello, Bud Robertson of the Brandon Sun. When will your projectors allow you to make a definitive announcement on when schools and post-secondary institutions can reopen? I'm not talking about June, I'm talking about September, which is only 4 months away. And as you know, with post-secondary especially, students have to know whether they're going to go back to school or whether they're going to have to start looking for a job now.
Yeah, so this is all part of our process, our phased approach. Certainly this phase we're not able to look at schools. We need to do things slowly and cautiously. The projections, again, are one aspect of that. We look at some modeling and some of look at the effects of on younger people on the trajectory of the virus. We know that from a lot of jurisdictions right now, unlike other viral illnesses like influenza, children seemingly have less of a role to play in the transmission of this virus compared to things like influenza. So all these things we continue to learn, but when we can have a definitive answer in a pandemic, it's a real tough question. I can't answer that. It's going to depend on what we see, and we're going to do it in a phased approach, and we're going to do it in a very cautious approach.
Okay. And follow-up, how do you envision enforcing some of these? There'll be a lot of places opening. Are you looking at public health officers making visits, random visits, or is it more going to be by complaints? What are your thoughts on that?
Yeah, it's going to be both. So the public health inspectors have, a lot of relationships out in the community. They can, most of the things when we talk about enforcement, most enforcement they do is just education. Most of it is questions or follow-up, and people comply. So rarely do they need to write tickets or have any enforcement with that, and we expect that trend to stay. We've had a lot of engagement with the business community and their councils, and everyone knows how important this is. So it's not only about whether they can get a ticket or not. Everyone knows that they don't want to be responsible for spreading the virus. They want to protect themselves. They want to protect Manitobans. So certainly enforcement has to be an aspect of it, and it is. But by far, we know Manitobans have been taking this seriously. Our numbers prove it, and we expect Manitobans to continue that.
From APTN, Brittany.
Good afternoon, Brittany Hobson from ABTN National News. I just want to make one clarification. So for the travel restrictions, does that include the ones for north or above the 53rd parallel? Like that's still not allowed, and that could change come June 1st if that changes.
Right, yeah. So that restriction will remain in place, and that one will remain in place until rescinded. And so that's part of our strategy, is that we're gradually opening things, but we need to do what we can to protect those at highest risk of severe outcomes, and that would include, an outbreak in a remote, isolated community. And so we're going to continue that restriction at this time.